Now my watch is 12:02, and I would like to welcome all of you to this webinar, Tuberculosis and HIV in Ukraine during wartime, Challenges and Possible Collaborations. My name is Tobias Alvin, and I'm the chairman of the Swedish Society of Medicine. And I'm also a pediatrician and an associate professor in global child health at the Karolinska Institute here in Stockholm. The aim of the webinar today is to inform Swedish medical doctors and others with an interest about the situation of tuberculosis and HIV in Ukraine during the ongoing Russian invasion. We read every single day and follow the Russian aggression in Ukraine with horror, and we do what we can to support Ukraine and work on different issues here from the Swedish Society of Medicine. And one of them is also to look at other issues related to this, and one of them is now tuberculosis and HIV. And today we want to highlight the situation of multidrug-resistant tuberculosis and the importance of continuous treatment for both tuberculosis and HIV. And we also wish to share information on why tuberculosis and HIV are important illnesses to target, also in a wartime situation like this. The risk of further lives lost and increased transmission of both tuberculosis and HIV due to factors such as healthcare disruption, malnutrition, overcrowded refugee camps, human trafficking, and poverty are some examples of issues important to discuss in the webinar today. And further, we wish to seek ways for how Swedish healthcare and Swedish medical doctors can work together with our Ukrainian colleagues on tuberculosis and HIV in Ukraine, and including people fleeing to Sweden and other countries. The webinar today is organized by the Swedish Society of Medicine Global Health Committee and the Swedish Society of Medicine Students Junior Doctor Section, SLS Kandidat-Underläkarföreningen. And it's Hanna and Sixten who are here with us today, who have organized the seminar, and thanks so much for doing all the hard work to get this done. And today we are joined by three experts. First, we will listen to Olga Pavlova, medical doctor and deputy director at PATH Support Tuberculosis Control Efforts in Ukraine project. And you, Olga, you have over 20 years of TB control experience in Ukraine. That will be followed by Andrei Dudnuk, associate professor and respiratory physician at the National Pirogov Memorial Medical University in Vinnytsia in Ukraine. And you are working clinically with tuberculosis patients in Ukraine. And that will be followed by Taimur Nori, psychologist and expert in HIV and migrant health at the European Center for Disease Prevention and Control, ECDC. And you, Taimur, are currently working to support Ukrainian refugees with HIV. And the presentations will be followed by a discussion where you have the possibility to ask questions. And the best is to do that via the Q&A function in Zoom. And you can write your questions either in Swedish or English. And please use that during the presentations, and I will collect all the comments, questions to the end. If it's not something burning, that will take that during the presentations. Again, a warm welcome to all of you attending this webinar, and an extra warm welcome to our guests. With that, I would like to hand over to you, Olga. Olga, the floor is yours.
Thomas, nice to hear you and all colleagues, and thanks for your attention for Ukraine and for all support which we have now in this hard situation. I thought about the TB situation in Ukraine, some introduction about this. In previous years, the fight against TB is one of the priority for the national public health. And we do all the best for the control TB and for the decreasing number of TB patients in our country and decrease mortality, morbidity from this disease in our country. Like you see at these charts, we have progress in this, and we hoped that we will have end TB like all world will plan to do this in nearest years. and but we have now a slightly different situation, and I'll present about this shortly. If we talk about the problem in Ukraine, what main the problem in TB control we have? First of all, we need to say about TB and HIV co-infection. And if you, know, maybe you know that this proportion among the TB patients in Ukraine is almost 20%. It's higher rate of TB HIV co-infection among TB people. But again, we have a good progress in control TB and TB co-infection in nearest time, because we have implemented in the country the anti-TB start and treat strategy for HIV control, and after that we have a good results in TB HIV control in Ukraine too, and you can see this in that slide too. Other problem in previous years we have with drug resistance TB. Since 2040, Ukraine was among the country with high level of drug resistance in the world. But our country to implement many activity for the control of this situation and decrease number of the DRTB patients in our country. And you see, we have a good progress on this in previous years, but in 2020 we have a problem with when COVID started. We have some problem with TB detection, with drug resistance TB detection, and our progress was slowly, but we think that we still have a good chance for control. First of all, because we implemented a new WHO recommended system for detection of TB and drug resistance TB. In whole country, we have access for the rapid molecular genetic test for this testing, and we implemented new strategy in which all patients with suspected TB have possibility to test it by gene expert and have quick results with TB or DRTB tests in 1 day or 1 or 2 days. This is why we have good results, and all these results we saw in the chart of these treatment outcomes. Like you see in the previous years, we have slowly but progress with treatment results. In TB cohort, in TB HIV cohort, and in cohort with MDR-TB patients. That is why we implemented all WHO recommended algorithm for the treatment, for the diagnosis, for the support of the patients, because we have a huge number of social support activities for our patients in our country, implemented through the Global Fund activity. That is why we have we have the idea we want to have a good results in next year for the decreased number of TB and to end TB in our country. And then, sorry, I have some. Okay, and I want to tell you one. About our project. Our project started implemented in 2019. Now we have 30 years of the project. Our main goal, the reduce TB epidemic in Ukraine with support of country in this way, and we support implementation all new approaches, new tests, or new model of care for the patients in our country. We work in half of country and support for the control of this problem. We have 4 objectives, and then when COVID came, we have 5 objectives with emergency response on COVID time too. But all these objectives are covered by all activity for TB control in the country. During this activity, we implement some new ideas or new approaches, for example, new approaches for active case finding. In previous time, Ukraine more focused on the passive testing for patients with symptom of TB. If we look at the history in Soviet time and post-Soviet time in our country, we have the strategy for fluoroscopy or X-ray examination for whole people in the country. It was very expensive, but not good for the not good result, without good result. That is why we learn about this history, and we implemented new strategy during the project, in our project regions, like active case finding, where we selected people with a group risk from TB, and then detected only these patients with all methods which we have, especially with X-ray machine in the regions. And this detection allowed us to increase number of patients with TB. During the COVID time, we lost some patients, and this active case finding support us to detect patients and start early treatment for these patients. It was a good activity. Then as the activity, like results, you can see that we not only looking for the patient, but this is early diagnostic for the patient. That is why more than half patients could start treatment not at inpatient setting, but start treatment in outpatient setting because they have a good condition. That is, for us, it's a good idea for the implementation in our country. Our project activity is quantiferon testing or LTBI testing in our country. Before, in our country, for the LTBI testing, we have only tuberculosis skin test. And this test, quantiferon test gold, we have, but only in the private laboratory, and this test was very expensive, and our patients could not do this test routinely. We support in our regions to implement this test routinely for LTBI testing, and like you see, we have possibility to test almost all patients from TB contact in our regions, and this activity we have started only in the end of previous years, but we have a very positive result. Among tested patients, we have positive results, quantiferon results almost 20%, and then these patients start LTBI treatment. And what interesting in our situation, because you saw we have a high level of the drug-resistant TB, that is why during this activity we start prophylaxis treatment, not only for the susceptible TB, but for the contact with XDR TB2, and have good results. You see the main principle for the control of TB in our country, but all this principle I could say in 2 words. WHO recommendation we were implemented in our country, and then we need to, for this, we need to do the reform, and like you see in this slide, all levels of medical care involved in TB control, and all all specialists, medical specialists in Ukraine have his place in this huge activity. And then we have a one. You know, this very crucial situation now, I do not want to put in this many words, because I know Andrei told more about this, but what I need to say, that this war not only for the military men, it's for all of us, And we have many attacks of the medical facility, including TB facility, and we have a problem with the TB services now in Ukraine. In this picture, one of TB facility which was destroyed during this war. And like you know, we have many problems in each levels of the care for the patients, and we need to support for each regions who was attacked by war. And we have increased number of migrants and increased number internally dispersed patients, and we need to implement more other activities which maybe we do not do in the previous years, but now it's a huge problem which we need to solve. And I need to say thank all countries who support for our people, our patients who leave Ukraine because of the war, and support him for his treatment, continue his treatment in in your country. And thank you so much. I hope I have time for discussion in the for the end of this webinar. Thank you very much, and Slava Ukraini.
Thank you so much, Olga, for that presentation, both about the situation before the war and now during the war, and some challenges, but also opportunities. We keep all the questions and comments of the three presentations so we can discuss them together, but we already have some questions, but we'll keep them. And with that, I would welcome Andriy Dudnak, Associate Professor and Respiratory Physician at the National Pirogov Memorial Medical University in Vinnytsia. Warm welcome to you, Andriy.
So thank you for introduction and the invitation for this meeting. Do you see my first slide?
Very well.
It's visible. So just to pick up the topic what Olga said, I fully support that last year's Ukraine demonstrated a really nice progress in tuberculosis management. So we successfully implemented many activities allowed us to minimize the COVID pandemic effect on TB services. So our Ukrainian patients had really great access to XDR cartridges for gene expert, XDR cartridges, and detected earlier extensively drug-resistant tuberculosis. So I think that in Ukraine, they had better access than in many European Union countries. For that. Also, due to more active involvement of non-governmental sector, so the support of patients during hospital and ambulatory phase of treatment was last year's was really better than before. And all these factors, unfortunately, all this achievement was cancelled by the war, because now we are like going back for many years. So the first point of my background, that I'm a clinician working with active TB patients, mostly in XDR, MDR, TB department, and I was also actively involved in COVID management, and I have a private practice as a respiratory physician. So commonly, I saw that in the last years, our clinical achievement, the regular updating of clinical guidelines allowed me to manage patients not differently with many European Union colleagues. So it was really a positive moment. But at the same time, at the war, so that's how airport in my native city, Vinnytsia, looked before war and now. So it totally changed all logistics, all management, and the whole country now looks like that. So of course, now we have another challenges than we previously had. And usually we talk about patients with tuberculosis. Many of them were classified as hard to reach communities, but at the moment we have hard to reach areas, and all these frontline areas, all these neighboring to the frontline regions are hard to reach. So we now not talking about hard to reach people, but we are talking that square kilometers of Ukrainian territory occupied and near the front line is really hard to reach. First of all, due to the shortage of active bombing, fighting, and also due to the shortage of transport connection and even petrol. people wake up at 5 o'clock just to order the queue line and to get petrol or natural gas for their cars. So that's a very huge logistic sense, because even if we have medicines, even if we have diagnostic tools, so it's very difficult to offer it for the patient who live in active fighting areas. So another problem that a lot of people fled the country. So that is how refugee center in Poland near the border looks like, that overcrowded settings. Ukrainian people really help that a lot of countries organize this support, but at the same time, unfortunately, in many of countries, they don't provide active screening for tuberculosis, allowing to minimize the risk for people who spent a long time in overcrowded centers, overcrowded areas, so in some shelters, some temporary residence places, in bunkers. So unfortunately, a lot of people before crossing the border, like refugees, spent weeks or months in these areas. So as a question, how many people with HIV and tuberculosis have had to leave Ukraine as a consequence of war, is very complicated question, because even using any calculator, which can be calculating, yeah, we understand that mostly that is a female citizens with children, so women with children, but at the same time, no one calculator will calculate the relative risk of a recent infection, because people spend 2 months, for example, in bunker with someone with active tuberculosis, could be recently infected, and in case of starvation, no money, no food, no any healthcare access. So the risk to get infected with active tuberculosis and then developing of active tuberculosis disease in close future is really high, and that is very difficult to predict and to calculate. Also, I need to mention that the frontline areas, that is, first of all, areas with one of the highest tuberculosis incidence of Ukraine, the east and south. So that's why it also should be mentioned that mostly people who are internally displaced persons, or who fled Ukraine because their houses were destroyed. So they mostly from this eastern region where prevalence of tuberculosis is much higher. It's also very difficult to calculate in average, because we don't know exactly the geographical distribution of our refugees. But in numbers, now the situation looks like over 6 million people fled Ukraine, and of course, most of them in neighboring European Union countries. And in numbers, how it looks that if Ukraine has last year notified cases, like estimated notified cases as 44 TB cases per 100,000 population. So for example, in Vinnytsia, it's really drastically small, but we should understand that COVID also has a significant impact on these numbers. So every third patient with pulmonary tuberculosis has drug resistance. So we should understand that, for example, if in Poland, totally, they have just 40 notified rifampicin or MDR TB cases, so about 2%. So if we will calculate even with usual basic simple calculation, so 1,500 new TB cases will come, and if set of them, 500 will be with drug-resistant tuberculosis, that is a really big number. So if Poland had 40, and that is plus 500 resistant TB cases, I think that is the biggest challenge for the national healthcare system, to manage this huge number of drug-resistant cases, to have experience, to have possibility to provide medicines, and even the diagnostic capacity. And another huge problem, that is availability of some second-line drugs. So in many areas, unfortunately, they are out of stock. So we are talking about clofazimine, cycloserine, and even delamanid. In many countries, patients have no access routinely to these medicines, because probably it's not a huge problem in such countries. But when a lot of millions of people, or hundreds, thousands of people came to European Union countries, so I think this shortage would be a big headache for TB clinicians responsible to manage these drug-resistant cases. So what issues are Ukrainian refugees with TB and HIV facing during their forced migration? I think in European Union countries, the main problem that is, first of all, language barrier. Because even if person understands that he could or she could have tuberculosis, or if they have tuberculosis, it's very difficult to notify about that, to inform any healthcare service about that. First, people will afraid to say it because they probably will afraid that they will be locked or isolated, and that is the first barrier, first challenge. And second point, that people simply have a huge language barrier to explain about that. Also, when refugees crossed the border and fled Ukraine, they also had, they are not familiar with the functioning of healthcare systems. They could have some basic access to healthcare services, but regarding tuberculosis management and even think about tuberculosis, probably in most of countries, no one even asks them about that, because active screening is still is unusual thing, exceptions and a standard rule for refugees. That's why I think the most important thing at the moment would be improving in Ukraine, improving diagnostic of tuberculosis, especially in military conflict, war-affected areas. And for that, a mobile diagnostic TB laboratory would be very helpful, even to perform the screening among soldiers participating in the war, as well as displaced population, a population who cannot visit standard traditional healthcare facilities. For screening by anyone and anywhere would be very, very helpful as the technologies which will allow, like Fujifilm recently developed technology allowing to investigate, to perform X-ray for the patient in any place, at their homes or on the street. It will save a lot of lives, and this chest screening provided, for example, in any areas where we can do it, at least it's a safe place, yeah. So it could help to diagnose not only tuberculosis, but even community-acquired pneumonia, COVID, and many other things. So I say even some injury, for example, pneumothorax, some fractures of ribs, etc. So I think that more short treatment regimens, including treatment regimens for latent tuberculosis infection based on isoniazid and rifampicin, would be very helpful at that moment, because people cannot take medicines for a long period of time because it's problematic. It's very difficult to plan even for 1 week, and what to say about half a week. So it will be, the war drastically will reduce the adherence to treatment, because simply people have another priorities in their life. First of all, to survive, not thinking about to prevent something, even tuberculosis. The digital adherence technologies, that's the basic thing which we need to keep an eye, because traditionally the adherence to TB treatment is very poor. But at the moment, unfortunately, in the conflict areas, the access to internet also is mostly a dream. And that's why patients, even who, before the war, even who were under any video controlled therapy, at the moment probably are self-controlled or without any control. So the main conclusion, and if there is no wind, we should row. So we should proactively try to find any solution. It doesn't matter where a person stayed in Ukraine or abroad, but we need to understand that tuberculosis will always follow any kind of conflict, and this war in Ukraine, that is historically the biggest movement of people and crossing the border. So after Second World War, and unfortunately, that is the biggest challenge what we have at the moment. Thank you for your attention.
Thank you very much, Andriy, for that presentation and showing some of the horrible challenges that you have. Just a photo from the bombed airport. I mean, it's just unbelievable as you finished that this is 2022 in Europe, and but also giving some ideas about possible solutions. For example, the portable X-ray machine and the mobile diagnostic TB laboratory, showing possible ways at least to tackle one part of this, not the war itself, but some of the side effects from the war. And I really agree with you. If there is no wind, row. I think that's a good ending and a good segue over from you, Andriy, to Taimur. Taimur, please. No, perfect.
You hear me, Tobias?
Now I can hear you very well. Thanks.
Okay. I'll try and go through this quickly so we have some time for questions. So my name is Taimur and I work at ECDC, and I'm an HIV specialist, but have worked a lot on the Ukraine situation over the past couple of months. You've seen some numbers before. This is data from yesterday from UNHCR. You see that 6.6 million people have fled Ukraine. You see at the bottom here that they are tracking now people that are returning back to Ukraine. We don't really understand how much is back and forth of the same people. That's not being documented very well, but people are clearly returning back. And you see the numbers that Andrei showed before, where most people are returning, coming to in the neighboring countries. What information is, where do they go then after going to these countries here? Now, people are registering in certain countries, but not all Ukrainian refugees are registering. So we don't have a clear understanding of where people are moving to. And that is going to be really important in terms of understanding treatment needs, vaccination needs, treatment for HIV and TB, etc. So that's something that we're trying to get our heads around. We did quickly, before I go into the HIV situation, very quickly, we did some publications. I won't go through all of them, but I want to mention one of them, this one that was done very quickly after the war started, on some operational public health considerations for the prevention and control of infectious diseases. And I'm just going to highlight 3 messages. So we wanted to really make the statement that public health authorities should increase awareness among community healthcare providers regarding the need to ensure access to health services and continuity of care for displaced people fleeing from Ukraine. Now, this sounds obvious, but it hasn't been obvious in the past. And what has been great with this situation in terms of looking for something positive is that EU Commission and countries and the Parliament, etc., came together to put together this council implementing decision. So basically, this gives Ukrainian refugees certain rights for residency, for work, accommodation, education, social support, and healthcare. So this is amazing. We didn't see this in 2015 migration situation. This is the first time, to my knowledge, that this has ever happened, that refugees coming to Europe have these strong rights. They've always had some basic rights, but not these strong rights. So we have the system in place to provide really high quality care for our Ukrainian friends and colleagues. Another important message we're coming out with is that we need to have an integrated approach to healthcare provision, including infectious diseases. Now, ECDC's mandate is on infectious diseases, but we also, because of that, and because of our, place in the EU system around health, sometimes it may place too much focus on infectious diseases. We know that most Ukrainian refugees coming are women and children and elderly, and have other needs much more important than infectious diseases, such as maternal health care, cardiovascular disease, or any kind of other areas, really important, but we can't really focus on that, unfortunately, but we are trying to work with partners, and I'll say a few words around that going forward. The top priority usually we get from our stakeholders is this issue of routine vaccinations and the fact that we need to address gaps. And I'll just say a few words around vaccination. So again, in 2015, the migration crisis, and this became one of the most important questions we got is, how should we treat people without documentation of vaccinations? And our position is that if no documentation exists, or if vaccination status is uncertain, the individual should be considered as unvaccinated. And we have structured this along priority vaccinations because countries are asking us which vaccinations should we prioritize. And these are the ones that we think should be prioritized. And these are other vaccinations that should be considered depending on national and local circumstances, which season we're living in, and other contexts. So that is a really important message. And I'm sure you're all interested in this area as clinicians in Sweden. This is a tool that we work with UNHCR, WHO, and IOM to really, because of the huge flows of migrants, we saw more Ukrainian refugees coming to EU in the first week of the war than we did in all of 2015. In 1 week, we saw more than 2 million people arriving, and in 2015, we saw 1.3 million coming to EU in total. So the flow was really large, and we needed to provide something very short and kind of give frontline healthcare workers a snapshot. And we worked with these partners because we wanted to go beyond infectious diseases. So the first 3 areas touch on COVID, vaccine preventable diseases, HIV and TB, but we also want to touch upon these other issues that are really important: non-communicable diseases, mental health, sexual and reproductive health, etc. So a short, snappy tool that could provide guidance to frontline healthcare workers. So very pleased with this document. On to HIV. So we work together with partners you see here, mainly the European AIDS Clinical Society, but also the European AIDS Treatment Group and others, to provide a short, brief message on how to ensure high quality HIV care for displaced people from Ukraine. And some of the key messages, obviously, is that we need to ensure free and easy accessible HIV care. We need to ensure secure electronic transfer of medical information between Ukraine and receiving countries, and I'll say a few words around that in the next slide. Our really important statement is to hold stocks of ART to be able to provide at least 90 days of therapy, because there's lots of movement, and we wanted to secure that the patient has 90 days until they've really settled in a host country where they can get further access to treatment and care. On this issue, I was deployed to Poland for 3 weeks over the past month, and I visited hospitals in Poland, and they are not able to meet this requirement anymore because they are seeing more and more Ukrainian people coming for treatment. So what they suspected in the beginning was that Ukrainian citizens came with treatment, but that is being running out now, and therefore more and more people are coming into the hospitals, clinics seeking treatment. So they are only able to provide for 30 days. And this is something that we've been trying to help them with, to secure drugs through other European countries and other mechanisms that we have at the EU. And also, we think it was important to take the opportunity to provide easy access to HIV and other blown virus testing for people as part of a general health screening that happens once people have come to country of settlement. On this issue of sharing information between Ukraine and EU countries, very quickly, WHO and other partners, including ECDC, developed this standardized protocol. So if a doctor, if you in Sweden meet a refugee from Ukraine, all information, clinical information, is centralized in Ukraine. So with this standardized protocol, you're able to send this to the central ministry in Kiev, and able to get clinical information about the patient and what regimens they're on and other clinically relevant information. So this is a really important tool that you should be aware of. We hosted a webinar on some of the key considerations around the continuum of HIV care for refugees from Ukraine last week. And I'm just going to share some of the data that we presented during that webinar. So the latest data we got from Kiev just a month ago as part of the reporting to something called the Dublin Declaration. This is data from 2020, and basically there are different estimates on the HIV prevalence in Ukraine, between 0.6%, which is our estimate, the ECDC, and 1%, which is the UNAIDS WHO estimate. And we are basing this estimate based on this number here of reported people living with HIV in Ukraine from the Ministry of Health, and divided that by the total population in Ukraine and arrived at 0.6. So this is really important, and I'll come back to that shortly. But out of those people here that are living with HIV, 184,000 have been diagnosed, 152,000 people are receiving treatment, and 143,000 people are living with suppressed HIV virus. Now, if we look at this continuum of care, these numbers, and compare them to the estimates in the EU, EEA countries, we see that Ukrainian citizens have poor outcomes along all steps of the continuum of care. You see that here. And we're going to apply this to the estimate the number of people that have arrived to the EU. So I'm coming back to this issue of trying to estimate the number of Ukrainian refugees living with HIV in the EU now because of this situation. And as I said before, up until last week, we've been relying on this UNAIDS WHO estimate of 1%, which is, the first thing we had. So it's great that we got that number out there, but now we're trying to refine that number. So as I said, based on the number that we have, it's 0.6. So anywhere between 33,000 and 56,000 people, Ukrainians have come to the EU because of this war situation. Now, we've worked with our modelers to see if we can improve those estimates. So what we're trying to do now is look at other UNAIDS estimates when it comes to prevalence in different age groups. So between those 0 to 24, the prevalence is of course much lower than compared to those old age groups. So if we're able to break this down, instead of this crude estimate, to break this down and looking at the Ukrainian refugees coming, we get very different estimates. So anywhere between 24 and 30,000 refugees that have come to the EU that are living with HIV and AIDS. And a third scenario is where we're looking at the global burden of disease estimates, which are also breaking this down by gender. And we know that most refugees coming are women and children and elderly and have different age bands, different estimates. But looking at this, using this scenario, we see probably anywhere between 9 and 13,000 people have arrived. So our impression now is that the estimate is anywhere between 9 and 30,000. So it's still a very broad range and a very high number, but it's trying to refine the numbers now to really to inform treatment, prevention, testing and treatment programs on arriving at these numbers. So that's been an important challenge these past couple of weeks. Looking at these numbers, it's a busy slide, but I'll just try and show you the different scenarios I just talked about. So this is the estimated number of Ukrainian refugees living with HIV in the EU. The 1% estimate arrived at 55,000 and the global burden of disease arrived at 9,000. And based on these numbers, we can see now how many refugees are living with unsuppressed virus. So depending on which scenario you use, you arrive at different numbers. And out of those that are living with unsuppressed virus, you either undiagnosed, you're diagnosed but are not yet on treatment, or you're on treatment but not have time to reach viral suppression. So again, this numbers is going to be important at national level to estimate first how many Ukrainians have received, how many of those are HIV positive, and what is your estimate on the undiagnosed fraction, etc. So what kind of testing services you need to provide for these citizens, and also, but important to state, the vast majority are on treatment, are virally suppressed. Around 60% of those are going to be virally suppressed, and therefore ensuring treatment and care programs going forward is going to be really important. This issue of which drugs to supply in Ukraine, I think it's called TLD, which is a drug that isn't licensed in the EU. So there are discussions now on what kind of drugs to provide to Ukrainian citizens. To my understanding, you know this better than I do, that it doesn't really matter from a clinical perspective. I think any drug would be valuable, but it's this issue of going from one single pill to multiple pills and then going back to Ukraine, what kind of challenges that poses. But that's something that's being discussed now. And just to finalize, so this key considerations document is something that we're working on based on the discussions we had last week in this webinar. We will publish these estimates for the first time. We'll address some of these issues along the continuum of care, including stigma and the importance of support, housing and income. And we aim to publish this towards the end of next week. And I would like to acknowledge some other colleagues here at the ECDC and some of the consultants. Over to you, Tobias.
Thank you so much, Tamor, again, on getting this perspective and showing the importance of looking at different models and see that the numbers you get into the models are so important because, and then with the model, you get something out, and that's what you will be based on. And it's very nice to see the overall work that you're doing at ECDC. And also thanks for raising issues about how to keep, not just look at HIV or TB in isolation, but look at it from a health system perspective, and that you have to have the patient in the center and not a separate illness. And as you said, there are mostly women and children who have fled Ukraine to other countries. So for example, this about routine vaccinations. Olga, Andriy, and Taimur, together, this was a very comprehensive picture, but there is much more to discuss and learn. Please, if any comments, questions from the participants listening, write in the Q&A. I think I've already covered one of the questions, but in times of war, why is it important to keep focusing on diseases such as TB and HIV? You, Andriy, you were alluded to this, that of course the war itself is the most important, but why should we continue discussing an issue like this? Olga, Andriy, or Taimur, anyone who would like to start?
I see Andrei wants to start.
Yes.
So, of course, any other diseases will have the same bad sequencing of the war, but first of all, people with tuberculosis and HIV are vulnerable population who will get catastrophic consequences of war, because the medicine, antiretroviral therapy and anti-TB medicine, is not so simply to go to the pharmacy and buy. Also, we should understand that that is socially contributing to this. So many people with tuberculosis are really poor people. So and the war will change their poverty to the catastrophic situation that even simple access to food will be a dream for millions of people. That's why we should first of all protect them with supply of medicines. It doesn't matter where they will live. But of course, people with tuberculosis and HIV have another diseases, and we should keep in mind that diabetes mellitus will not disappear after war, as well as some opportunistic infection, or pharyngeal candidiasis, Kaposi sarcoma, as well as aspergillosis. So all these people should get comprehensive access, but at least with limited resources, we should supply them with basics. And that's why we first of all discuss about TB and HIV. And what is also important to mention is that HIV people without adequate antiretroviral therapy probably will have tuberculosis soon, or will die due to the tuberculosis, as TB is one of the main cause of death in this category of people.
Thanks a lot, Andriy. I think that was comprehensive, but maybe Olga, do you want to compliment, or Taimur? Olga?
Yeah, thank you. And for me, we talk about TB and HIV because of stigma and discrimination. And we do a lot of activity in our country for reduce stigma discrimination of this for these patients. First of all, we start all treatment activities in same day that this patient have diagnosis. That is why this patient will not have any epidemiological problem for other people. But in EU country, I think it could be one of the problem for this patient to talk about his diagnosis, because they have a vision that in you have no TB, you have no HIV. That is why if people say about this they have a problem in your country. That is why I think we need to talk about this with the doctors, because we need to reduce the stigma from for our patients too, because Ukrainian people is not the people, or Ukrainian people is not the people with TB, or it's not the people with HIV. But some patients have this problem, and we need to create the patient people-oriented approach for these people to have their care in your country. If they have no problem, they have no stigma, you have no future problem with these diseases. Thank you.
Thanks so much, Olga, for that. And I think stigma and discrimination, it's an issue often related to HIV and TB in many countries. And so important to raise the issue and try and fight that in all countries, in all settings, but maybe especially now. And and I hope this webinar will try and support that we can be open about that. This is an illness like others, and we should treat it like that. Then it's a bit more complicated to treat, for example, multidrug-resistant TB, but we should not be afraid of it. And I think it's really, really important. So thanks for raising that. And something, if anyone here has ideas how we can work on that here in Sweden and other countries, please share that in the Q&As or in the chat. Taimur, something you would like to add on that?
Well, I think a lot has already been said. I just want to, raise this issue of hierarchy of needs, right? When you're fleeing a war situation, you have to flee for your life, and you need to flee from dying. You need to get food and water. But once those things have settled, and many of the first millions that came to family and friends, mainly in Poland, and came into a situation which was, compared to 15, where most of them were in dire camps with horrible conditions, that really hasn't happened in this case. So that's really something positive. I think, I can't remember if it was Andrea or Olga talked about these refugee settings or accommodation centers that have been built up. To my knowledge, most people are not there for a very long time because there are further disputes in the community, which is really good, because those could be dangerous in terms of infectious disease spread. But my point is that obviously for me is once you have fled the war, health is a really top priority after you've settled all these other basic needs, and we can't just ignore them. And I want to mention one thing. I don't know if this is anecdotal, but this came up in one of the meetings with the EU delegation to Ukraine, where they mentioned, especially in the early parts of the war, that they had heard, and again, I'm almost hesitant to say this because it could be very anecdotal, but they said they were concerned that that people in Ukraine weren't really aware or stopped. Sorry for my English here. They hesitated fleeing to the EU because of fear that available to them, and that they wanted information translated into Ukrainian where it was crystal clear, so everybody knew that this shouldn't be a reason not for fleeing from war. I can't say if this is true or not, but I think that's an important consideration, that it felt safer to stay back home because treatment was secured, and that's really important, that people should know that treatment is available in the EU. And just finally, resistance is really important. So if we stop and start in treatment, that's never good for any disease, right? So that's critical. So I'll stop there, yes.
Thanks a lot, Taimur. And I think that's also building on what you presented, that there is a database on all ongoing treatment for HIV patients in Ukraine that is possible to get in touch with if you're a clinical physician working here. And that's important to know, that you don't start from scratch, but you look at what has been done and you build on that, and that we can work together as colleagues in Sweden and other countries and Ukraine. And that's leading me to...
Maybe I add something.
Please, Olga.
Yes, and if we talk about TB and HIV, or if Sweden doctors have some patients from Ukraine who talk that I have TB or I have HIV in previous time, you need to know that in Ukraine we have national register of these patients, and all medical information, even if patients came in your country without any medical documents, we have all these records in our country, and we could share this information very quickly with colleagues about these patients, about his treatment history and something else. I think it's very crucial information for the doctors for the collaboration. Thank you.
Thanks a lot, Olga. We got a question here from Per Björkman in Malmö, and if we can distribute information on how to reach the ART database for patients coming from Ukraine. And maybe Taimur and Olga and Andrew, you can share that in the chat, and we will also add that on the website of this webinar with information about this. Thanks, Per, for raising that and bringing that. So we'll put that on the website.
Put the link in the chat as well. And this link is in English. Of course, this standard protocol, it's in Ukrainian as well. And the patient needs to agree with this, that you contact the doctor. So it's all crystal clear in that document, but I'll put it in the chat as well.
Please put it in the chat, then we'll add it on the website. Thanks for that question. Then I would like to finish with one final question to all of you. and that's something coming up often when we have seminars related to Ukraine. It's how can Swedish physicians and others in the Swedish health system support TB and HIV patients, both fleeing Ukraine, but also back in Ukraine. What are your thoughts there? Olga, do you want to start?
First of all, I want to say thanks, because all support and even this webinar, it's a huge support for us, because we know that you're thinking about us, you want to support us. It's very crucial for us in this situation, because sometimes we think that we almost one by one with this problem, but all support, all webinars, all attention for this part is very crucial, important for us. This first of all. Second of all, I want to say that here in Ukraine we have a huge number of the national non-governmental organizations, social support for the patients with TB, with HIV, and almost all patients with TB and HIV have own social supporters here in Ukraine, and these people could provide some social support for, even if a patient live abroad, they have possibility to call for his social workers and discuss some problem, and they're looking for the support from the social part of this diseases. Second one, all people with disease have the number of the doctors, and if they have some question about his medical condition, they have possibility to call in Ukraine and discuss with his doctor this question too. I think it's very important for me, and maybe colleagues add something else.
Thanks so much for finishing with that, Olga. Excellent comments and good for next steps, I believe. Andrei, please.
I think that one of the best support from our Swedish colleagues would be providing the nice healthcare for our patients, irrespective to their nationality. But at the same time, I think that it would be not bad to organize in any refugee centers where the people registering and getting any support, some simple questionnaire that people having any chronic diseases, including tuberculosis, HIV, or diabetes, can claim that they need non-stop support or non-stop supply of some medicines. It can be formulated in any question, but at least as far as I know, commonly it's neglected. So the patient could not notify about their disease and even not notify that they need, for example, insulin. So that's the problem. The next point, that how people from Sweden can help Ukrainian people staying in Ukraine, or internally displaced people. So I think the government of Sweden supports Ukraine too much. We're very thankful for that. And at the same time, I think that every person helps paying the taxes, but at the same time, the government logistically, so at centralized level, we have a huge challenges at the moment, and we are very thankful not only for weapons, but also for medical support, any medicines like that, yeah, and diagnostic tools. Thank you.
Thanks, Andrei, and we will do our best to continue to give care to all patients here in Sweden, as all physicians should do. And then also we lobby and try and push the Swedish government to provide both or weapons. That's also something that we do provide, but also medical supplies at the same time, and we will continue with that. And then your input during this webinar will be further input to our continued advocacy on that. So that's very important. Thanks, Andrei. Taimur from ECDC.
Yeah, just quickly, Sweden provides some of the best HIV care in the world and TB care. You have great outcomes. So ensure access to that. Even those who are diagnosed, not all of them have access. So work on that. There's another group which are undiagnosed. We don't know how big that group is. So you need to support your public health authorities in testing, so they can access this brilliant care. And finally, a really important comment, which I'm starting an internal group here now, is on the long-term commitment to support people in Ukraine. The consequences are going to take many, many decades probably to come back to high quality care in Ukraine. The consequences are going to take a very long time. It's not only when the war stops, but it's going to take a long time to build up the system. So I think this long-term commitment on part of all clinicians, not only for the situation in Sweden, but in Ukraine, keep on fighting for that and supporting them. So over.
Tamer, I think you ended with the final lines that I thought ending this webinar with. Continue working together, colleagues and other with an interest in these issues, and that we're in this together, and trust everybody in Ukraine. We're thinking about you. We want to do even more, and we will continue to do what we can from our side. And I would like to finish to say to all of you listening to the webinar and to the panelists, if you have other ideas how we should engage from the Swedish Society of Medicine in this, please reach out to us and we will try and do what we do. With that, I would like to give a big applaud to Olga, Andriy, and Tamer, and then also to Sixten and Hanna for organizing this. And thanks so much also to everybody who listened and provided questions. And a big applaud to Olga, Andriy, and Tamer, Sixten, and Hanna.
Thank you, guys.
Keep in touch, and goodbye.
Bye.
Goodbye. Thank you for organizing.
Thank you.
Thank you so much, everyone.